Femibion 1 is available on tablets intended for oral administration. One pack of the drug contains 30 tablets. They contain 10 vitamins, the most important for planning pregnancy or already pregnant women. It is the lack of these vitamins that expectant mothers most often experience. It is used as a biologically active food supplement for women planning pregnancy and pregnant women before the end of the 12th week of pregnancy as an additional source of vitamin C, E, D3, B1, B2, B3, B5, B6, B12, folates, biotin, choline, iron, iodine, selenium. Active ingredients: folic acid and methylfolin, the most readily absorbed form of folic acid. Scientists often refer to these vitamins as the happiness vitamin or the good mood vitamin. It is impossible to overestimate their influence on the body, especially in pregnant women. It is both a normalization of an emotional state and a beneficial effect on almost all internal systems: cardiovascular, immune, digestive, nervous. A sufficient amount of folic acid in the body of the expected mother is the key to the normal course of pregnancy and the health of the baby. Vitamin A, also called tocopherol, is deliberately called bringing children. This is how the word tocopherol is translated from Greek. Thanks to vitamin E, a balanced hormonal background is maintained in a woman's body, and this is extremely important both at the stage of pregnancy planning. It contributes to the maturation of eggs and the onset of ovulation, and during pregnancy itself, it is necessary for the normal development of the embryo and the sexual fixation of the fetal egg in the uterus. Vitamin C is rightfully considered the best assistant in strengthening the immune system. Being a powerful antioxidant, it effectively prevents the development of infections in the body, resists allergic processes, fills the internal organs with glycogen. In a word, it gets the health of pregnant women. B vitamins B1, B2, B5, B6, B12, they participate in the metabolic processes of the body: metabolism, the production of red blood cells, tissue regeneration, and very importantly, the development of the fetus, especially the liver and heart of the unborn child. In addition, the drug contains other useful vitamins. Iodine normalizes the thyroid gland. Nicotinamide improves the digestive system. And biotin regulates sugar levels, normalizes the nervous system. Such a set of vital elements makes Femibion 1 indispensable during pregnancy. Recommendations for use: women planning a pregnancy and pregnant women before the end of the 12th week of pregnancy take one tablet one time per day with meals. Swallowing whole and drinking plenty of water. Duration of admission in agreement with the doctor. Contraindications: individual intolerance to the components. Before use, it is recommended to consult a doctor. Women with thyroid disease and/or taking iodine preparations should consult an endocrinologist before use.